Hi, everybody. It's Adam with HeartValveSurgery.com, and this is a very important surgeon question and answer session all about hypertrophic cardiomyopathy. I am thrilled to be joined by Dr. Pietro Bajona, who is one of the leading cardiac surgeons at Allegheny Health Network in Pittsburgh, Pennsylvania. During his fantastic career, Dr. Bajona has performed over 2,000 cardiac procedures, of which many involved some form of heart valve repair or heart valve replacement. Dr. Bajona, you and I have known each other for many, many years. Thanks so much for being with us today.
Well, thank you, Adam. This is great. Thank you for give me this opportunity. It's great to be here and talk about hypertrophic cardiomyopathy with the HeartValveSurgery.com community.
Yeah, so we're going to talk all about hypertrophic cardiomyopathy, and I'm thrilled to learn about what you're doing there at Allegheny Health. But to get started, Dr. Bajona, why did you want to become a cardiac surgeon?
This is a great question, and I actually wanted to be a heart surgeon since I was a little kid. I was probably around 8 or 9 years old. I remember my father having this Life magazine that was talking about the first heart transplant, and since then, that's the only thing I wanted to be.
Dr. Bajona, I love hearing that story. And now let's dive right into hypertrophic cardiomyopathy. Can you help the patients out there understand what is it and is it common?
Well, Adam, hypertrophic cardiomyopathy is generally an inherited condition, so generally genetically linked, with an incidence in the general population, we know now around 1 in 200 patients. And this condition basically brings the muscle inside of the heart to thicken. And this thickening is impeding the blood flow outside of the heart. And hence, the patients become symptomatic.
Dr. Bajona, thanks for that explanation. Now, maybe we can backtrack real quick. What are the symptoms and maybe the potential risks of hypertrophic cardiomyopathy?
Symptoms are very variable. The most common one, Adam, is shortness of breath. So that can be anything in our life, but the most common is that. And then we have a vast array of symptoms that can be lightheadedness, being fatigued, passing out, syncope, arrhythmias, fast heart rate. So patients come to us and but for the most part, telling us, doctor, I can't do anymore what I was able to do 6 months ago. I used to play tennis and now I can't do it.
Dr. Bajona, those symptoms seem like symptoms of many other cardiac disorders. And I've got to ask you, are there any misconceptions about hypertrophic cardiomyopathy?
I'm glad you asked this question because it's way more common than you think. Patients many times are diagnosed with either sleep apnea or asthma, but there's nothing wrong with their lungs. The causes of these symptoms is a heart condition, and as I said, this is very common. And for the most part, all you need is just an echocardiogram to actually get rid of this misconception and guide you to the right treatment.
I'm glad to hear the echo can pick this up quickly, Dr. Bajona, and I've got to now follow on with the question about treatment that you alluded to. Is hypertrophic cardiomyopathy treated regularly, and what are the outcomes?
Hypertrophic cardiomyopathy is treated successfully all around the world. The key point to a successful treatment is to see a physician who is specialized in treating hypertrophic cardiomyopathy. And the vast majority of the cases with hypertrophic cardiomyopathy are treated successfully with medication alone. There is around a 20-30% of patients where medications are not enough. Then we're starting to think about septal reduction therapies. And mainly there is 2 septal reduction therapies nowadays available. One is septal alcohol ablation that is performed by interventional cardiologists. And one is a septal myectomy, which is a more invasive and procedure and is done by heart surgeons.
Dr. Bajona, I love hearing that there are multiple paths to treating hypertrophic cardiomyopathy. And I'm sure the patients are wondering is, can one or both of these treatments help reduce or eliminate symptoms and risks?
Yes, and that's why I like treating hypertrophic cardiomyopathy patients, because it's very, very rewarding. And when the patients get treated by a team of dedicated physicians who are expert in hypertrophic cardiomyopathy, they actually get treated successfully. And in some cases, some patients who are going through surgery or septal reduction therapies, they can have a consistent and very significant reduction in their symptoms. Most of the cases also completely not going to back normal life.
That is great to hear, Dr. Bajona. And I've got to ask you a question, which I'm sure a lot of patients watching this video are thinking to themselves, why at HeartValveSurgery.com are we having this discussion about hypertrophic cardiomyopathy? Are the two cardiac diseases related? And if so, how?
Yes, they are interrelated. And many times we see patients with hypertrophic cardiomyopathy and they are sent to us with a diagnosis or either severe mitral regurgitation or severe aortic stenosis. Many patients with obstructive hypertrophic cardiomyopathy have mitral regurgitation. But most of these cases, the problem is not the mitral valve itself, but is the ventricle who's thickened. So we need to focus on the ventricle and not on the mitral valve. Few of these patients will need some mitral valve treatment, but the vast majority will not.
Does hypertrophic cardiomyopathy cause any type of valve disease?
Hypertrophic cardiomyopathy per se does not cause valve disease, but it can cause regurgitation secondary to the thickening of the heart, as we were mentioning before. And many patients come to our attention when they, with severe mitral regurgitation, because the mitral valve is distorted and is leaking. And as we know, chronic severe mitral regurgitation increases the size of the left atrium, and many patients get diagnosed and referred to us when they actually come with atrial fibrillation and they're quite symptomatic.
Dr. Bajona, we are learning a lot today. Thanks so much. And now I've got to ask you a question. What is your best or top pieces of advice for patients out there?
Well, Adam, usually I have two advices for my patients. The first advice is to get informed. Read, study everything that you can about your condition. The more you know about your condition, the less scared you are, and the more you are in condition to take the right decision for you. The second advice is, if you need treatment for hypertrophic cardiomyopathy, you need to go to centers where there is a team that are dedicated and passionate, and they are able to take care of yourself in the best way possible.
Dr. Bajona, I cannot thank you enough for taking time away from your very busy practice at Allegheny Health Network in Pittsburgh, Pennsylvania, to share these wonderful insights about hypertrophic cardiomyopathy. Thanks for being with us today.
Well, Adam, thank you very much again for the invitation. It was great to talk about hypertrophic cardiomyopathy. I hope patients will have a lot of questions. I'm happy to answer at any time. And as you say all the time, keep on ticking.
Thanks so much. You took the words right out of my mouth, Dr. Bajona. Keep on ticking. Thank you.
All right. Thank you.
Hi, everybody. It's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel. Watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.